This works. Ah, hi. How are you?
Good. How are you doing?
Good, good. Can't complain. It's a beautiful day, a little windy, but
Yes.
you
Sunny at
know,
least.
I know, so it's nice. At least it's not like yesterday.
hmm
Yeah. But thank you guys for coming. This is part 2 of the Instagram Live series that we have going on. This week I have Dr. Catherine Powell. She is a physical therapist here in New York. So before I talk too much, I'll just let you introduce yourself, say where you're from, what you do, all that good stuff.
All right. Well, thanks, Rebecca, for having me. Funny enough, we're both from Valley Stream,
Yeah.
so we didn't know that. We grew up a couple miles apart and
Mm-hmm.
went to, different high schools, but same town. So it's a small world.
Yes.
Um, I am a mobile physical therapist here on Long Island, meaning I come to you whether you're gym, home, or workplace when those places are open. So
Exactly.
right now, I've predominantly been treating through telehealth or virtual visits. And, people always ask, how can you get better without the hands-on part with physical therapy or the physical
Exactly.
part? And it is possible. And a lot of my patients have been getting better with just, specific movement protocols and exercises best for their bodies. So it's really cool. Telehealth has been growing for years, but now
I'm sure it's at its
it's,
peak now.
yeah,
Yeah.
COVID really brought it to the public's awareness.
Yeah.
Um, so I got into physical therapy because I've had so many injuries myself. The biggest one was in ninth grade when I had um, ankle surgery. I came down from a rebound, tore the ligaments in my ankle,
Oof.
and then I was put on the sideline for the next 3 to 6 months.
Oh no.
Um, and it was that injury that I realized how much an injury is not just physical, but also emotional.
Mm-hmm.
And you can't do just regular things normally.
Yeah.
You can't get out of bed without thinking twice about it. You can't put
Exactly.
on your shoes. Walking into school on crutches is totally a, you know, different perspective when it's snowy, like snowing and icy, and you're crutching in and you're like, okay, my crutch is
Yeah.
about to fly out. And I was fortunate enough to have an awesome physical therapist who exposed me to the profession. And from that point on, I knew I wanted to help others just as he had helped me.
That's awesome. That's so awesome. I want to bring up something that you said about the weather and just like physical ailments. A lot of people be like, "Oh, when it's raining, my knees hurt so much." Like there are so many factors that go into like how your body is feeling every day. Like you might not feel optimal every day. So whole bunch of different things that come into play to keep a quote unquote optimal body, which is what everyone wants. Um, so you played lacrosse, correct?
And then I also played soccer, basketball growing
Okay,
up.
so yeah, all
Three
full
sports.
around athlete. Yeah, full blown athlete. That is so awesome. What are the typical demographics that you treat, whether you're going to their home or whether you're using telehealth to treat people now? Yeah.
So usually I treat a lot of orthopedic conditions. So that's like your neck, your back, your shoulder, your knee. It does, post-op, so after surgeries, but not always. Sometimes, it could just be this big, dull knee pain or wrist pain that you've had for a while.
Mm-hmm.
Um, and so I do tend to work more with active adults and individuals who, it doesn't have to be a formal injury either, but you might have a new fitness goal, or you might want to retrain for an event that you've always had an injury flare up in the
Mm-hmm.
past when you start to add mileage or you start to, lift more than you have. And then
Mm-hmm.
that kind of deters you because, your Achilles wasn't bothering you. You start working out more and now it acts up again. And you just want to get past that hurdle. So I also offer like wellness sessions and more tune-ups for people who might not have a specific injury, but they know they're not 100% either. And they just want to be able to train without limitations or compensations.
Got you. And that's a big thing. Compensations. I kind of want
Mhm.
to go a little bit into that, and just what it is. Because some people don't understand body compensation. Because I always lead with the theory, and I'm always telling my clients, like, the body is the perfect machine. So it will do what it needs to do to get you through the day. So, like how you said, if you're training for a marathon or whatever may have you, and you're running every day 10, 15, 20 miles, but you're ankle, your Achilles is getting extremely tense. You're feeling that pain. It's adapting to all that stress that you're putting on your body to
Mhm.
be able to perform for this marathon. But the biggest thing is people don't understand the recovery part of things and how to assess and detect compensations in their body and then how to correct them. So
Yeah.
what is maybe like a misconception about body compensation and like physical therapy or something that you work with your clients on?
So if one of you ever have a provider tell you you can't do something ever again,
Oh, of
like you're not
course.
allowed to run
Yes.
again, you're not allowed to go to CrossFit, like run far away from that provider.
Yes.
Um,
I had not a physical therapist, a chiropractor. A few years ago, I had an issue with my back and found out I had degeneration from T4 to T6. So I had some disc degeneration there, and he was like, you cannot deadlift, you can't do this. It was a list of all the things that I couldn't do, and it made it seem like wow, like I'm 1,000 years old, my back is gonna break. But I'm here probably like 3, 4 years later, like I can do back bends, I can do like all these things I'm not supposed to be doing, and I feel
yeah,
so much stronger doing
yeah.
it now than back then. So sorry to cut you off, but yes, go ahead
No, no,
into that.
and then so many people get that message, from providers that they're, seeking guidance for and, trust or want to trust. And that, like, the body is very resilient. And
Yes,
even if you have an injury or degeneration is very common with aging, but it
exactly.
does not guarantee you need to sit home and do nothing. That's actually worse for you. And you
Mm-hmm.
need to learn how to properly load the system and properly adapt your body and do work in a way that is safest. Because everybody should be able to deadlift, everybody should be able to squat. Because we pick up the laundry basket, we pick up our kids, we pick up our, dogs or whatever have you.
Exactly.
We're doing things constantly that require these foundational movements. So by having somebody guide you and making sure you're doing them properly every time you go to do yard work or every time you bend down at work to complete your job, you need to put your body in the most optimal position and limit the compensations. And so that's where I pride myself on saying, like, hey, this is your goal. You want to get back to this? We'll make it happen. We might have to temporarily adjust your exercise plan or program
Mm-hmm. Mm-hmm.
to gradually load the system to put you in the safest, you know, position and allow the tissues to adapt and get stronger so that you can get back to deadlifting 200 pounds, so that you can get back to CrossFit or spin or yoga or running a marathon or whatever, or just playing with your kids outside and being able to go on a walk. Um,
Exactly.
that,
Exactly. And no, no, I'm sorry. I was cutting you off. But go ahead.
oh no, no, and that's just, yeah, the goals of you know of the other misconceptions about PT is most people don't know what we can actually help you with, or
Yeah.
most people don't know what we actually do, because you think I have a tight muscle, I should get a massage, and it's like, but what's the root cause of that tight muscle? Why does that back spasm keep occurring?
Mm-hmm.
Let's see how you're moving, where that's getting triggered from, and then give you the tools to help yourself long term. So you don't have that recurring back spasm or neck spasm or knee pain, you know.
Exactly. And that's the biggest thing that I also educate my clients on. It's like wherever you're feeling the pain, that 99% of the time, that's not the real issue. It's really somewhere, it's a neighbor lingering nearby, a neighboring tendon, muscle, or it might be something very far. Like I've had people who've come in for severe neck pain, but there was imbalances in their foot. So it just traveled up the chain and then they felt it in their neck.
Mm-hmm.
So it's really important, I feel like, and the biggest thing going forward. And I feel like in the healthcare system and just treating people who are, like how you said, they're athletes, they're training for these huge events, or they are just a normal everyday person. They want to be able to play with their kids until they're in their teenage years, to understand that like these movements that we do for exercise, like how you said, squatting or like deadlifting, they are normal everyday movements. And by training them correctly from the beginning without loading them with heavy weight, that's how you prepare for those. Like I said, I'm gonna deadlift 200 pounds today, and I'm gonna do a clean today. Like all those things, you need to have that foundational preparation in order to do those big loaded movements.
Mm-hmm.
And another thing that you had said earlier with adjusting someone's plan, like say we use the example of training for a marathon. If you tell them like, listen, we're going to stop lifting weights for like 2 to 3 weeks, and they feel like, I'm weak, I can't, like I'm nothing anymore. But it's just like, we're going to get back to that, but we're going to make sure you're doing it correctly so you're able to lift weights for another 10, 15, 20 years, because the game
Mm-hmm.
is longevity. We don't
Yeah.
want to do this for 10 minutes, we want to do this for 10 years. So that's really the name of the game, and really just like re-educating people and retraining not just their body but mentally and emotionally as well, to not feel less than just because like, oh, I can't deadlift 200 pounds anymore. Like when that chiropractor told me I couldn't squat or deadlift, I'm like, well, what am I supposed to do,
Yeah.
you know?
And
So,
that too, a lot of people, when they go to the physician's office or wherever, they get told what they can't do, and then they don't actually get told what they can do. And they're kind of lost. Like you said, you're like, well, what am I supposed to do now? Nothing. Like we just sit at home, feel old, and continue to have pain and
exactly.
degeneration. And, you're a provider too who looks at the whole picture, because like you said, they might have neck pain, but you're looking down at the foot. And that is the key. You have to look everywhere to
Hmm.
find what's truly causing the problem. And that's what helps people tremendously.
Exactly. One of the things that I felt like is interesting, especially with physical therapy, because sometimes you're kind of your hands are a bit tied when dealing with insurance, because they really force you to compartmentalize the body. Like you're treating their neck, so we're gonna work on their neck, you're gonna build codes for their neck, and so on and so forth. But like how you said, if it's really an issue with their foot, like what do you do in that instance where you give them a full assessment, their area of complaint is not really the root cause, you find the root cause elsewhere? Like what do you do in that situation?
And that, yes, you bring up a big, like, and huge point. So many people come to me with multiple issues. Or again, maybe the main issue is their shoulder, but they're like, you know what, my back's bothered me for a little while too. It was never crazy intense, but like that's bothering me. And the whole reason why I started Cat Powell Physical Therapy is because I was getting frustrated having my hands tied by the traditional healthcare model,
Mhm.
because they were like, you can only touch their shoulder. You only have X number of visits with this patient. If they progress too quickly, we're going to cut them off. If they plateau and don't progress at the rate we want, we're going to cut them off. And they don't know the individual. They don't know the person in front of me. And, maybe they have had a big event happening at home, whether good or bad, and that's
Mhm.
affected their plan of care.
You know.
And yeah, that too, having, again, I'm all for getting patients back to whatever activity they enjoy and love, because
Mhm.
they want to do it and it is possible. And, and also setting realistic goals and expectations to get there.
Exactly.
The other thing too, of like, a lot of people, they get this pain, or maybe they've had shoulder pain for years, and it's like, well, I just need surgery, that's the only option. It's like, no, it's
No,
not.
it's not. Yeah, that's the last
you know
and all
sir,
be all. Yeah.
yes, yes. And it's like, surgery has a time and a place, but a
Mhm.
lot of people can get better conservatively.
Mhm.
Why put your body in risk for this trauma and, potential complications that can occur? As opposed to, if you can get better, you know, with just exercise and other holistic approaches, choose that. Like,
Exactly.
research right now is saying physical therapy has the same outcome as a back surgery. So let's say for a standard slip disc.
Gotcha.
So why would you potentially risk, them cutting a nerve or cutting
Mhm.
something in this surgery if you're going to have the same outcome.
Exactly.
And then you have limited range of motion for the rest of your life by having that surgery, by having that scar tissue build up, by having any fusion or, kind of hardware put in. Now you lose that natural slide and glide of the bones, instead of saying, oh, I could have just treated that with exercise, become more mobile anyway, and not have all the secondary side effects of surgery and
No,
other risks.
exactly. Exactly. And listen, at the end of the day, I'm like a super nerd, so I love to watch surgery. Like, it's so cool to me. But like I said, I completely agree. It's like a last resort. Because again, it's a huge traumatic event that your body goes through. It's not a 1, 2, 3 thing, and then the after the recovery, and again, it's the whole mental emotional aspect of it as well. So it plays a huge role in how your body's gonna move and react going forward.
And there's no quick fix or magic pill in any setting. And that's too why like physical therapy isn't a glorified profession, because it takes work. It's not, a passive treatment where, okay, I can be relaxed, I don't have to do anything. It's like, no, you need to work. If you want to see results, I can't run that marathon for you. I can give you the tools to prepare you for that and how to safely progress through that, training program and strengthen, areas that need work. But I can't do the actual run for you.
Exactly.
And that's where empowering the patients and empowering people to kind of take control of their life and the health is the ultimate goal.
Exactly. And that's the biggest thing, because someone will come in for a session and they feel amazing. Like after it's done, like, oh wow, they have this whole new sense of like energy and they're vibrant and they want to feel like this forever. But I'm like, all right, listen, you're going to feel like this today, tomorrow, maybe even the day after that. But you're going to go back to your regular life and you're going to do the regular things that put you in this predicament in the first place. So you need to do the work to maintain the work that I just did. And then if they come back, say a week later, 2 weeks later, like the second I put my hands on them, I'm like, you didn't do any of those things that I told you, did you? And they're just like, oh, it's like, I can feel it. I can feel it. You can't lie to me, because I can literally feel it. Because there's the first thing that I always do when someone lays on the table, I put my fingers, I just put it underneath their Achilles, so they're laying in a prone position. So I just put my fingers underneath their Achilles tendon and I would kind of just push into there. And just the tension right there that I feel just by pushing into the Achilles tells me a world of things, because it just tells me like, okay, I can see how tight up the chain your back line is. And then I might just do like some lateral movement side to side, things like that. And I'm like, okay, so we really didn't do anything. You've been sitting on the couch for weeks now. How's your thing? Like, oh, well, and it's just like, listen, you can keep coming back here and we'll feel great for 3 days. But it's like how you said, if you don't do the work to maintain and keep that retraining of your body active, because when you go for manual therapies or when you go to physical therapy, it's retraining your body to this new norm. So if you don't keep going with this new norm, your body's going to be like, this is old news. We're going to go back to the way things were, because that's what it's used
back to the comfortable position.
Exactly. So you have to keep going and keep retraining it. And then when you get to that point of like, all right, we've retrained to the highest that we can for this aspect, let's add something on. Like maybe instead of just doing body weight work, let's add a band onto it or something like that, or maybe like a lightweight. That's when you start the progression of things. But it's not like a one-time fix or a one-time fix and then you could jump right in and just start throwing 200-pound weights all over the place. Like, that's not going to work.
We all want that. We all hope for it. It's not
ideally
realistic.
In utopia, but like that's not the case. I wanted to, this is all amazing. I wanted for you to show us a few exercises that we can do at home, and then maybe I could add like a few stretches in there. Because I feel like everyone who's watching right now, you're either watching this from your laptop or on your phone, so you're either here. I would hope you bring your phone up here. So just something to keep them active, mobile, or things that they can do in between working and things like that.
Yeah. So we'll run through a few basic stretches and a couple different exercises just to help get the shoulders down and back, help improve your posture. So oftentimes when we're sitting or we're forward head or we're looking down, the back of our neck gets very tight, and then our deep neck flexors get very weak because they're being stretched and lengthened.
Mm-hmm.
So the first exercise you want to do, and you can do this in the car, you can do this in the chair, but are chin tucks. So it's a
Mm-hmm.
cervical retraction. So all you're doing is making a double chin. And some people might feel that stretch all the way up the back of their neck. And then, good, just like that. And you can play around with the angle you're doing this at. So you can rotate your head to one side and do a
Oh.
chin tuck there.
Oh yeah, I feel the difference in that. Yeah.
And one
Okay.
side might be tighter than the other. And then you could do it for longer holds and durations to build the endurance of these muscles. The other one you can do is a scap retraction. So that's the shoulder blade squeeze. So you're squeezing your shoulder blades.
Mm-hmm. We can see you. Go ahead.
Down. Okay,
Gotcha.
good. Down
Mm-hmm.
and back. And just trying to bring the shoulders out of the ears. We all hold a lot of tension. Good. So a common compensation I see is when I first start people with this exercise is they'll squeeze up
Yeah.
or they activate the traps. And that's what we don't want. It's the down and back motion that we want.
I tell clients a lot of time when I get them to start activating back, I just say, pretend that there's a pencil in between and you want to squeeze the pencil. You don't want to let this pencil go. So that right there, that imagery, then they're like, oh yeah, the pencil. I just put my fingers right there in the middle of their scaps. And they're like, oh yeah, then they get used to the movement.
Yes. And whatever, if you find a way that works for you, or like a cue, or like in both yourself as the patient, use it. So like the other stretch, so now we have the upper trap and the levator scap that run along the back of the neck. So to stretch the upper trap, so right now we'd be stretching this side. You pull your head to one side, and then you rotate your head up. And if you want to, you can always reach down with the side that you're stretching, hold on to the side of the chair, and lean away more, and you're going to feel it. And then you can do the Michael Jackson stretch to get the levator. So now you're putting your nose to your armpit. Same thing. It should feel similar but different. Yeah. And same thing. You can reach that opposite arm and hand down towards the floor or hold the side of a chair and pull.
I actually feel that like down to my forearm when I do that.
So, and that's any other tension, like, and this is where you can breathe into those restrictions. If you can't breathe, you've gone too far. Because if you can breathe, you're telling your body you're safe. You're able to relax those muscles and those tissues. So that's something to always check into, because oftentimes when we're stressed or we're doing something hard, like we hold our breath, we tense up. And so when you're working out or when you're doing stretches, you want to always check in with your breath. Are you still breathing? Can you take a 90% full breath into this stretch or this hold that you're doing and then relax? And if you need to ease up, that's okay. Or if doing this is causing, any neck discomfort or headaches, as maybe it's your body's fighting back a little bit because it's not used to that position.
Exactly.
So to retrain, you can kind of pulse in and out of this position. You don't have to
dynamic.
Yeah, more dynamic or shorter holds, like 5 seconds instead of 30. So you kind of feel out your body. You start with what works and feels best, and then gradually work into this. And again, the other thing is if you can create a standing desk, doing these exercises throughout the day, or especially once you're feeling tight or achy, you've been sitting a while, or you realize you're on your phone, like you said, try to bring the phone up to you. So you can do a chin tuck as you're keeping it at eye level, as opposed to bringing your head down.
Exactly. Now, those are really, really great. Just one thing that I love in addition to all those, because I definitely have people opening up the sides of their neck, because they'll feel the tension in the back, but it's really like the anterior portion, the lateral portions of their neck, just to open up the front here. So I just like to do, it's real simple, just like a butterfly position. Place my index finger and my thumb right below my collarbone and just kind of pull the skin down just a little bit, and then just look up to the ceiling, and you feel all like the neck fascia there. If you want, you could take like an underbite of things, rotate your head back and forth, or even my favorite thing that I like to do with this that I discovered is if you lean forward and back from your torso, you feel where the stretch changes. It gets a little bit deeper. When I lean forward, I feel it a little bit more down to my sternum.
Uh-huh.
When I lean back, I feel it a little even further down. But it's like how you said, like changing the angle of things.
Yes.
Hit different fibers, different points of the muscle, the fascia, all of those
Hmm.
things, and it gives like a greater, well-rounded effect.
Yes. Find those restrictions, find the direction that doesn't feel 100% and hold it there. Breathe into that
Exactly.
restriction. And you know what? And it might change day to day. It might change
Yes.
depending on how you're posturing one day, how, you're sitting another. And or maybe you finally release that direction. So now leaning forward with your neck up and back at this angle feels good, but coming here, oh, that's a little more gunky. So
Exactly. Take that time to really find those imbalances in your body. And if something feels more tense, more tight, give it more time to
yes.
release and to open up, because we're all connected and our body's one piece, but they're two different sides. So you need
Mm-hmm.
to maybe give one side more attention. Like how I said, my left psoas is not activating. So I'm like, I
Mm-hmm.
need to work on that. My right psoas, I could snap my fingers and it'll turn on. So I want to just see if there's any questions from anybody before we wrap this up. I know Instagram's going to give me that 2-minute mark, like hurry it up.
Yeah.
Um, let me see. People love the information. Thank you guys for tuning in. This is awesome. Someone said they just corrected their posture. Um,
Awesome.
so a question is, do you recommend taking any supplements to help our body, such as like fish oil or anything like that? So any supplements that you recommend?
So I don't really recommend any specific supplement. Ultimately, diet and nutrition is a humongous portion in healing and recovering. So if you are eating the right foods that are nutrient dense, like mineral and vitamin dense, like they will provide you with whatever you need and you won't have to supplement.
Mm-hmm.
Um, but everybody responds differently. So it's also playing with diet and supplements is finding what works for you. Um,
Mm-hmm.
and this is where, like, as a physical therapist, I give general nutrition advice, more whole foods, less processed, and I can kind of give strategies. But directly with supplements, like seeing a naturopathic doctor or a registered dietitian, they would be able to guide you more specifically based off of your blood work and other
Mm-hmm.
lab values and any other medications you might be taking, because that also plays
Plays
a
a
role.
factor. Yeah,
Yeah. And so you
definitely.
don't want to take something like, an overdose on a vitamin because you've been taking, now you have the toxicity build up.
Mm-hmm.
So, it's kind of like nutrition and diet and supplements is all very specialized and it varies from one person to the other. So I don't have any specific recommendations
Okay.
aside from eat more of a plant-based diet, whole
Yeah.
foods, and stay away from the crap that stocks most of our, supermarkets.
Our supermarkets, all these fast food
Yeah.
restaurants that are open. Yeah, because that's really
Mm-hmm.
important. Because yeah, like I said, a registered dietitian, nutritionist, things like that, they would be
Mm-hmm.
more so able to figure out what is the best mineral composition for your body, because
Yes.
everyone's different. What you need is different from what I need.
Mm-hmm.
And like I said, you don't want to overdose, because that's something that I don't think is ever talked about, like vitamin toxicity, like how you can
Yes.
overdose on vitamins.
Yes.
Um, yeah, so it's in
And
our
depending on if
foods.
you have any blood disorders, if your
Exactly.
blood is too
Or
thick or
like,
too thin,
hmm
also staying away or eating more of leafy greens like is another big factor. So that's where, any other health issues you might have or any other specific nutrition or supplement goals, I would recommend seeing somebody who can analyze, all your lab work and bring you down the safest direction.
okay. I have another question that just came up. It said, do you recommend any specific pillow for people that suffer with stiff neck or neck pain?
So I sometimes have my patients bring in a pillow, or because I go to their homes, I can easily have them show me their pillows. So you don't want a pillow that is too thick. So I'm just going to take my couch pillow and I'll
Oh,
try to
please, yes, show
replicate this.
us.
So let's say you're laying down, and so now if I have a thick pillow, my head is pushed forward. Pretend I'm on my back.
Yeah.
So ideally, you want a thin pillow where your head is back and your neck is in neutral, kind of similar to that chin tuck position or in that direction. Same thing if you're on your side, you don't want to be on a pillow and have your head either kinked down towards the pillow or kinked away.
Okay.
So ideally, you want a pillow that's the right thickness to keep your neck in neutral, to keep it in line with your spine. Sometimes, let's say you have a thinner pillow, and maybe it's too thin, so your head is coming all the way down if you're a side sleeper. So putting a hand towel or a bath towel will bring
that extra leverage in that.
Maybe you don't need a second pillow, but it'll give you enough of space,
that elevation,
to bring you back in neutral. So again, you don't necessarily need a fancy pillow or an expensive brand. You just need to find a pillow that's the right height for you. So if that's something with a concierge therapist like myself, you can text me a picture of your pillow or have somebody take a picture of you sleeping and say, is this okay for my neck? And it's like, yes or no, or here, make this tweak, or do you have a different pillow that we can experiment with? And same thing with virtual sessions. Like, I could literally see how you position yourself every night.
Yeah, that's important. All right. Instagram gave me this. We have 1:25. Last question that just came in is like, what do you usually do for lower back pain?
That is a loaded question.
Very loaded and kind of like really general. It depends. There are so many factors involved with like lower back pain. It's usually not just lower back pain. So it's like how she said, it's a loaded question.
Liliana, feel free to reach out.
Yes.
And I'll be happy to learn more about your specific back pain and situation.
Yes. So please don't hesitate to reach out to Dr. Powell. So we have 50 seconds, so I'm just gonna cut this. Thank you everyone for coming and tuning in. This is part 2 of the Instagram Live series with the guests. Thank you, Dr. Powell, for coming in, educating us, teaching us body awareness. That thing about the pillow was great, because I was sitting here looking at my pillow like,
Feel free to send me a picture later.
No, I will. I will be like, is this good? Like, seriously. But yes, everyone, thank you so much. We'll be back next week, and definitely have Dr. Powell on again in the near future, because this is just great.
This is awesome. Thank you so much.
Yes, thank you so much. Everyone have a great day. Stay active, stay moving, drink a lot of water, eat good food, and I'll see you guys soon.